Depression is one of the world's biggest problems, as well as science's biggest mysteries. Depression can take on many shapes and form. The illness can be caused by many different things, can harbor many symptoms, and can be treated in numerous ways. Depression is an imbalance in one's brain where certain neurotransmitters are not working or communicating properly. I have a short video that explains how the neurons and neurotransmitters work.
Depression is one of the most common psychiatric disorders. Symptoms of depression are often subtle and unrecognized by both patients and physician. The brain contains a network of interconnected nerve cells called neuron. The junction between the neurons is called the synaptic junction. The transmission of impulses from one neuron to another is facilitated by chemicals called neurotransmitters. The impulse triggers the release of neurotransmitters from one neuron, which cross the synaptic junction and attach themselves to the receptors in the adjacent neuron, sending the message through. Later, the neurotransmitter returns to the initial neuron via the reuptake channel. One of the causes of depression is believed to be the depletion of the amine neurotransmitters serotonin and norepinephrine. Antidepressant drugs increase the availability of neurotransmitters at the synaptic junction by blocking the reuptake channel.
So as we see in that video, two of the main type of triggers or causes are usually biological or from trauma. If a parent or someone else in your family suffered from a type of depression disorder, there's a high chance that you can too. Another leading cause of the illness is a trauma. If it was a certain way of living as a child or something sudden or surprising like an unfortunate death in the family or a serious accident. And for someone who is already depressed, these type of traumas can actually trigger episodes or breakdowns. There are many different symptoms and effects of depression, and it's pretty much different for everyone. But with how doctors have evaluated and tested, there are quite a few who seem to be present in almost everyone's cases. Anxiousness, feeling tired, lonely and isolated, weak, the loss of joy, numbness, insomnia, loss of concentration, appetite change, hostility towards people, dark thoughts, headaches. It's described by people as kind of a constant ache that goes through your body every day, all day, just nonstop. Many people assume that people who suffer from this illness just cry all the time and cry themselves to sleep every night and things like that, but really what's even worse for them is suffering and feeling so drained and so weak that the tears don't even come anymore. It's this numb feeling that patients have only been able to describe as unbearable and tiring. It's a feeling like you can't do anything, like everything is too difficult for you to do. It's actually been compared to the Dementors in Harry Potter, where they literally suck away the happiness from your body and any memory of it. Clinical depression is often only presented between the ages of 15 and 34. This is why depression in younger people often goes unnoticed. It's incredibly difficult, especially from a parent's point of view, to distinguish whether their teenage son or daughter is actually suffering from a mental illness or if they're simply acting out and being a hormonal teenager. The illness too often gets ignored or belittled by others, and by the time it is detected, the patient is in very deep and it's already too late. Like shown in these charts is kind of in the one to the right here is the percentage of teens having major depressive episodes, especially in 16, 17-year-olds. I mean, how can a parent tell if their teenager is depressed or if it's just the hormones and the drama of school grades and love lives, friends, things like that. And the chart on the left here explains more of just not only depression, but any type of diagnosis among attention deficits or anxiety problems, behavioral problems, or things like that. And you can see that it's from 6 to 17 years of age. It's pretty crazy, and I mean, in schools, it often goes really unnoticed by people, and these kids are suffering, and it's extremely difficult. Postpartum depression is an awful illness, often developed by new mothers. In fact, 1 in 8 mothers develop this illness, and it can begin as quickly as minutes after the delivery of a child. It's thought to be triggered by the extreme shift in hormone levels. It's terrible because the new mother can't even be happy with their newborn child. It can lead to extreme intrusive thoughts, as bad as seeing your baby getting thrown against a wall, or even seeing yourself throwing your baby down the stairs. It scares the mothers and horrifies them. This can also be damaging for the child. At such a young age, any loss or absence of affection can result in serious mental health problems. But studies have shown that when a parent is in remission and or gets help, that the child's issues seem to fade as well. So, bipolar disorder is often linked or even confused with depression and is one of its forms. Bipolar disorder is a horrible illness in which someone can go from feeling complete euphoria to literally feeling like dying, all the while being very irritable and hostile. The problem is, many people who are depressed and seek help are given medication to help their depression, when really they're suffering from something different, like bipolar disorder. And the problem with this is that some medications that help depression actually can hurt a brain that is suffering from bipolar disorder. That's why it's really imperative for a doctor to be able to tell whether a patient is bipolar or simply depressed. To stop the confusion from happening, doctors have created a sort of chart of irritability for patients so they can note how they were feeling on a certain day, and a trained physician can determine what the disorder is and give the proper treatment. It's so hard to be able to live with such a disease. For treatments for depression, medication is one of the most ones used. Antidepressants have been around for over 50 years, and presently there are about 25 approved drugs to choose from. It takes about 6 to 8 weeks for the medication to kick in, which can make a trial and error process take years and years for someone suffering. Recent studies have also shown that in a brain of someone who's depressed, the prefrontal cortex and the hippocampus are smaller than they should be. Medication helps reverse the problem and re-puts them to normal size. Although there are always side effects to medication, that it is pretty much one of the most used and kind of successful methods in treating any illness. Other treatments involve electroshock therapy and ketamine. Electroshock therapy is used often and is proved to be very successful. It's where the use of electrically induced seizures is actually therapeutic. Some people have actually said after this procedure that they don't even recall being depressed. You kind of wake up and it's like everything's just lighter. It's most oftenly used in the elderly, and you can have to have the process done several times before it actually working. Ketamine is an injection clinically tried by doctors, and many patients have said that it has cured their depression completely, and also, like electroshock therapy, have no memory of actually being depressed. It's still in clinical trial. It still needs to test it a lot more because there have been signs of some sort of danger in the drug. Talk therapy is something extremely successful. Just to being able to sit with someone and say how you're feeling and just go there once a week or whatever, once a month even. It could be mixed with medication. It could be mixed with other things like exercise. Exercise has been proven to be a huge to have a huge impact on depressed people. And mix it with talk therapy, mix it with maybe some medication, maybe not. It all depends on the type of illness you're suffering from, the type of depression. But there's so many ways to help, and everyone just needs to realize that they're not alone in it.